Okay, I think we're almost ready to go. My colleagues will let in participants soon. And as I said, we will start the video, and I will start with my introduction. Welcome to our web debate in June. My name is Katharina Höhne. I'm a senior researcher with DiploFoundation. As you know, we organize these debates once a month in the context of the International Forum on Diplomatic Training. Today, we look at the gendered impact of COVID-19 towards better diplomatic responses. Before I introduce our speakers for today, let me provide some context. This year marks the 75th anniversary of the UN, and our web debates this year have focused on the United Nations and on multilateral diplomacy. However, in the context of our debate, there are two other important anniversaries this year. So there's the 25th anniversary of the Beijing Declaration and the Beijing Platform for Action, which represent a comprehensive roadmap for achieving gender equality. There's also the 20th anniversary of UN Resolution 1325 on women, peace, and security, which obliges states to promote and protect the rights of women in conflict and post-conflict situations. These anniversaries are, of course, part of a much longer process in the context of the United Nations, for example, marked by the first World Conference on Women in 1975. So on the one hand, we are celebrating these anniversaries and these milestones. On the other hand, the need for continued work on these issues is clear, and we have reasons for concern. Let me quote: "The limited gains made in the past decades are at risk of being rolled back. The pandemic is deepening pre-existing inequalities, exposing vulnerabilities in social, political, and economic systems, which are in turn amplifying the impacts of the pandemic." This quote comes from a briefing paper issued by the UN Secretary General in April. So based on this, here are the aims of our debate today. First, we want to highlight the role and importance of gender in diplomatic practice. Second, we explore the gendered impact of COVID-19. Third, we want to provide reflections from the work of UN entities, such as UN Women and the UN Population Fund. And fourth, we want to explore opportunities to, quote unquote, build back better in the context of this debate. So without further ado, let me introduce our speakers for today, and I'm extremely grateful that they were able to join us. We have with us Dr. Susan Harris-Rimmer, who is an associate professor and deputy head of school at Griffith Law University. We have Monica Farrow, who is the director of the UN Population Fund in Geneva. And last but not least, we have Mohammad Nakiri, who is the regional director of UN Women for Asia and the Pacific. Let me also take this opportunity to remind you that this debate is as interactive as possible. This means we're looking forward to your questions and your comments, which you can post in the chat. And with the help of my colleagues, Katarina Angelkovic and Natasha Perucica, we will bring these comments and questions back into our debate. But now, without further ado, I would like to turn to Susan and ask a very broad and therefore perhaps also challenging question, which is the following: why and how should we pay attention to gender in diplomatic practice? And perhaps even more pointedly, do we need feminist foreign policies? Over to you, Susan.
Thank you. I'm so delighted to be here. I'd love to start, as we always do in Australia, by acknowledging the traditional owners of the land where I am, the the Jagera people and the Turrbal people of Queensland. And I pay my respect to their elders, past, present, and emerging, and I pay my respect to the elders of the land on where you all are. And this is particularly important because I want to talk a little bit about the importance of preserving the rights of First Nations women in particular during this particularly difficult time. So I'm going to argue, it might not shock you, that we do need feminist foreign policies, but I'll explain a little bit about the idea of gender in diplomatic practice, because diplomacy is often seen as a neutral activity. But in fact, historically, we know that it's been the province of elite men or royals. So it's diplomatic practice has often been a bastion of prestige, of social class. Here in Australia, for example, it's still a site of Anglo-Saxon privilege despite our multicultural nature. Half Australians are first or second generation migrants, but that kind of diversity hasn't really made its way into our diplomatic service yet. And this is not unique to any particular country. So many of the Nordic countries and Australia and New Zealand are reaching near parity when it comes to men and women in their foreign ministries, but not at the most senior levels. And we've seen in the most recent study that 85% of the world ambassadors are still men, and that the most important posts are still generally held by men, even in New York at the United Nations. And of course, you only need to look at any G20 photo to see that most world leaders are still men. But there's been a very interesting discussion about female leadership and the COVID, which I'll get to in a minute. So I suppose what we think about when we study gender in diplomatic practice is that the language of diplomacy, the concept of statecraft and ministries, foreign ministries, reflect this male elite lived experience, which is the foundation of diplomatic practice. Most diplomatic practice today would be recognisable to a Renaissance person. Diplomacy is very unusual in the fact that it builds in unpaid spouses as a key to successful diplomatic work. So it's a bit unusual in that sense, that it's kind of the business model predicates an unpaid spouse who is contributing to the success of the embassy. So basically diplomatic research has shown that women's pathways to leadership in this space are impeded still by institutional obstacles, such as unconscious bias as to what kind of qualities create the ideal diplomat, but also discrimination built into the cultures of these types of foreign ministries, plus the added difficulty of postings, so the work-life balance transposed onto coming back and forth from countries at regular intervals. So why does this matter so much? Mary Robinson said in our first book on gender diplomacy that diplomacy is the heartbeat of international relations. So we know that people matter in international relations. And the idea about this work, or the kind of outcome of this work, is a recognition that we need as much talent as we can in the complex world of international relations, and that good diplomatic solutions are predicated on diversity of opinion. Diplomats are very important. They set agendas, priorities, resourcing decisions. And so I would argue that we do need feminist foreign policy for two main reasons. It responds to that historical inequity, but also it takes demographic analysis seriously. So there are very few diplomatic decisions or policies that are gender neutral. So we can see from the COVID crisis that men have higher death rates. Women might be more affected by particular economic measures. We know young people might have their careers interrupted or their education interrupted. Elder people have been, terribly affected by restrictions. We know Indigenous peoples, often remote Indigenous people, have been locked off from the rest of the world for many months. We know people living with disability have found these times particularly difficult to access services. So if you take a gender analysis, a demographic analysis, an intersectional analysis, you are much more likely to see the picture of how policies might affect people. As I said, if people are interested, we might say that the female leaders have done rather well. I don't think that's an essential anything to do with their womanness generally, but it's probably part of the style that many female leaders have to adopt. This idea of accepting expert advice, explaining clearly, high levels of trust in those countries, a certain amount of resilience to become the leader, a female leader of a country. So I would advocate for feminist foreign policy to close, because good foreign policy considers all the beneficiaries of that policy and avoids unintended consequences. And we've seen that where there is a lack of diversity in the people at the table, in the personnel making decisions, we get things wrong. So as an example of that, I think about the G20, the austerity measures imposed after the global financial crisis were designed to be gender neutral. That's not the way they worked out. They were devastating for women in the public service because they targeted the public service in particular, closed every woman's refuge in Greece and half the refuges of the UK that were crucial to dealing with domestic violence. Not a consequence that was ever conceived of at the economists sitting around the G20 table. So we do need more diversity, and we need better analysis generally, which includes demographic analysis.
Thank you so much. I think what I find really important is to stress that gender equality within the practice of diplomacy leads to better policies, leads to better foreign policy decision making, and this is of very practical importance that we can hold on to. I will get back to you later, because you're doing very interesting research in this area in terms of women's rights in transition, and I will have a question on this later. But for now, I would like to kind of turn to our audience and bring you back into this debate just a little bit, because we also have two speakers representing UN entities. I would like to start with a quick poll to kind of see your opinion, your reactions on this. So what we have prepared for you is the following question. From the perspective of UN entities, the biggest challenge for addressing the gendered impact of COVID-19 is, first, lack of dedicated funding, lack of political will of member states, questions around the coordination between various UN entities, or fourth, lack of political representation of women. And we see the first responses already coming in here, and it seems to be a very clear picture so far. Very interesting. So I'm going to give maybe 5 to 10 more seconds to see where you're standing on this question. Okay, let us stop here and let me share results with you. So basically what we see is on this question, what is the biggest challenge for addressing the gendered impact of COVID-19 from the perspective of UN entities? Two things: political will of member states and lack of political representation of women. Very interesting. Thank you for participating. And I think this is something we will get back to in the course of our debate. But now, speaking of UN entities, let me turn to Monica Farrow, who is the director of the UN Population Fund. Monica, could you perhaps start us off with saying a little bit about the work that UNFPA is doing in terms of women and gender?
Okay, now I'm unmuted. Well, let me start by thanking you, Catherine, and thanking the organizers for inviting UNFPA to join this debate. It's really interesting, and I think that Susan has just provided us like the overarching framework that will now make our intervention, I hope, fit into a coherent narrative. Thank you so much for that, Susan. It was really, really interesting. And in a way, you know, I just feel prompted to comment on that from my previous life, but I will withhold, because especially having been a parliamentarian, I can relate to many issues that you just raised. But now I am in FPA, and I'm very proud to work with the United Nations Population Fund. And I think that most of you know that the UN Population Fund, we are the sexual and reproductive health agency of the UN. And we were born in '69. And when we were created, the goal was to provide countries with sound demographic data and analysis so they could inform the national development and human rights plan. Of course, then when as time passed by, we became more aware that we were well positioned also to broaden the scope of our action and to make sure that numbers and rights were brought together in the same conversation. So it was Cairo 25 years ago, the International Conference on Population and Development and its program of action that really operated what we call a paradigm shift. And we shift our work and our focus from human numbers to human rights. So in Cairo, you had actually the first intergovernmental conversation and consensus, and it's quite relevant to mention this, on population and development as if they were two virtuous twins. And what I mean is, the more you know about your population, the better you can plan for your development. And the more you invest in development, the healthier, the more educated, and the more prosperous population you'll get. So in Cairo, we highlighted the importance of investing in sexual reproductive health, and family planning had just been declared a human right in the TN conference the year before. We advocated for the need to give voice and invest in girls, to empower and plan for older persons, to leverage the positive link between population and migration, and just to name a few of the areas. Of course, that sexual reproductive health and rights has been the core of our mandate and program of action ever since. And because we work in 150 countries and territories to build the world with more dignity for all, our mantra is really to leave no one behind. And let me just share with you, you were talking about celebrations, and celebrations are important because especially if they allow people to recommit and also to take stock of the gaps and what needs to be done to literally walk the talk. We just had our 50th anniversary last year, and we also organized in November last year the Nairobi Summit on the International Conference on Population and Development, and we call it Accelerating the Promise. And the report just came out, and I'm happy to share it with you in the chat box. And the report from that meeting, and I was there. It wasn't really a meeting; it was a movement. It gathered people from all parts of the world and all paths of life, more than 9,000 people, and it was really clear that the shout out was there can be no human rights and there can be no development unless we deliver on the promises we made 25 years ago for sexual reproductive health and rights, and for zero unmet need for family planning, zero preventable maternal mortality, and zero GBV, gender-based violence, including child marriage and female genital mutilation. And this is why we focus most of our action in women and girls and the youth, the ones who've been left the furthest behind, be it in decision-making, be it in program design, and in delivery of services and commodities. And we also engage closely with parliamentarians to provide them with technical expertise so they can create an enabling national environment. And we also work with governments and communities and faith-based organizations and religious leaders. And so that people can get an extra flavor of what we actually do in the field. And I normally say that's where the magic happens. We are the leading agency on maternal health, not only on the normative part of the equation, but also when it comes to training, to services and product delivery. Our flagship programs that some of you may heard, the programs on supplies and on maternal health. We also run the global program to end obstetric fistula. We work a lot on sexual reproductive health for migrant women, and we focus also a lot on persons of African descent. We co-lead with UNICEF the two global programs to end child marriage and female genital mutilation. And we also have a critical role in humanitarian responses with our reproductive health and rights work, our Dignity Kits, that I think some of you are also familiar. And we work intensively on gender-based violence. We lead what it's called the area of responsibility on gender-based violence in humanitarian action under the current cluster system. And because it's also in our DNA, we support the census processes in many countries, because as our previous tagline said, because everybody counts, and we know that if you're not counted, you are not taken into account. And I could go on with all the areas of work that we are engaged and that have the same purpose. And this is our current tagline, delivering a world where every pregnancy is wanted every childbirth is safe, and every young person potential is fulfilled. And we do everything with a human rights-based approach. That means that people and their rights are at the center of all actions. But as I've said before, our focus is on women and girls and youth, the ones we've been left the furthest behind. And also let me just end by saying that because we are part of this wide family called the UN system, we are always championing a stronger multilateral architecture that shouldn't lose focus on the reason why we have been created 75 years ago, the opening sentence of the UN Charter, we the people. And I would stop here, Katerina, please make me stop.
Thank you so much. What I find interesting is that you highlighted both the historical context, but also what your agency is doing at this moment. What I find interesting now is to put this in the context of the COVID-19 global pandemic. So we've seen existing inequalities have been highlighted, exacerbated, additional issues, additional concerns have come up. So I'm really interested in kind of hearing from you, what are your key concerns in relation to gender and COVID-19? And how does that come up in your work? And how do you respond to these to this complex of issues?
Well, that's a critical question for us now, as you can imagine, especially for all that I've said before. And of course, the gender for us, it's both a building block and a goal in everything that we do. And when the COVID-19 crisis pandemic hit, and we became aware of the impact it would have on women and girls, and we are talking as early as March 2020, we published a technical guide on COVID-19, and it was called COVID-19: A Gender Lens, protecting sexual and reproductive health and rights and promoting gender equality. And of course, our starting point was acknowledging what you just said, that disease outbreaks, they affect women and men differently, and that pandemics make existing inequalities for women and girls and discrimination of other marginalized groups, such as people with disabilities, those in extreme poverty, older persons, they make it worse. And this needs to be considered, and this needs to be considered when decisions are being made, when programs are being designed, when resources are being allocated, because the impact will be different in these groups, and this has to be very clear. But of course, as a UN agency, we are working under the chapeau of the system-wide of a UN system-wide approach, and because also, needless to say, we are all in this together, and because we will only be as strong as the weakest of us. So what we've been saying very clearly, and I hope it comes across clear, is that we hear every day that the pandemic doesn't discriminate, but we also know that women and girls and people in vulnerable situations, they are suffering a disproportionate impact. Women make up 70% of our health workers worldwide, and they provide most of the care for children and older persons. All over the world, women, they continue to get pregnant, they continue to have babies, and they are facing fear and anxiety, and also the disruption of health services for checkups, for delivery at a clinic or a hospital, as attention is being focused now on COVID response. And in countries all around the world, what we are doing is we are working with governments, we are working with communities to maintain life-saving services and to protect the health and rights of women and girls. But we are also championing the right to sexual and reproductive health and rights, so that every woman has access to contraception, they can enjoy a safe pregnancy and childbirth, and they can also live free of gender-based violence and harmful practices such as FGM and child marriage. And we also know that with COVID-19, there is an increased demand on domestic violence helplines and emergency shelters around the world. Katerina, you've quoted the Secretary General, and he also said many women under lockdown for COVID-19, they face violence where they should feel the safest, in their homes. And this has made Secretary General António Guterres to urge all governments to put women's safety first as they respond to the pandemic. But let me stress another point. He also made a point of saying governments have to include women in all the decision-making processes to respond and build back and build back better. And this was also mentioned by Susan in her first remarks. But we are talking about inequalities and existing inequalities for women and girls, and discrimination on other population groups. And this is why we have been insisting in adopting a gender lens, but one that also reveals the intersectionality and the overlapping discriminations faced by adolescents, by older women, women with disabilities, indigenous people, and women of African descent. And again, just to mention a few. And here our message is very clear. We are calling the attention of governments and communities to the need to safeguard their sexual and reproductive health and rights at all costs, for services to continue, for supplies to be delivered, and for the protection and support of the most vulnerable. And we know that for this, we need data. And given UNFPA's expertise and engagement with the census process, we can easily support the development of quick population mapping based on recent census data, so that we know how many they are, where they are, and in situation they are in. It's and we think it's a critical tool. And I know that I've also mentioned that women account for 70% of the health and social sector workforce globally, and I would add that this makes them particularly vulnerable just for this fact. And I'm mentioning the health workers, but I have also to give a special mentioning to midwives, because we are celebrating the first International Year of the Nurse and the Midwife, and they do much more than delivering babies, which is per se a fantastic thing to do, but they educate, they empower women to live healthy lives and exercise their right to sexual reproductive health, and they need to be treated as frontline responders and be given the critical protection equipment, and they shouldn't be deviated to serve as emergency personnel. And let me just end by saying that we just released data. I've shared this before, but on the end of April, we shared some projections on what we call the calamitous impact on women's health of COVID-19 and of the responses to COVID-19. And what the research reveals is the enormous scale of the impact. Health systems are overloaded. Facilities, they close or they only provide a limited set of services to women and girls, especially when resources have to be reallocated, or when many choose to skip important medical checkups because they fear of contracting the virus. Also, it's been highlighted by many agencies that when global supply chains they get disruptions, it also may lead to significant shortage of contraceptives, and this is very important not only for women having access to family planning, but also because a shortage of condoms may result in an increased number of sexual transmitted infections. So we are also being very clear on saying the provision of modern, short and long active contraceptive information, counseling and services, including emergency contraception, is life-saving, and it should be available and accessible during the COVID-19 response. So just to finalize, I would like to leave 3 numbers for you to consider. And this is what our data showed, the data that I'm referring to, the projections. So what we foresee is that 47 million women in 114 low and middle income countries, they may not be able to get access to modern contraceptives. And this is adding to the number that we were already calling the attention of, saying that more than 200 million of women in developing countries, they want to plan their fertility, but they don't have access to the methods and the information and the service they need. And of course, a shortage of contraceptives could lead to 7 million unwanted pregnancies, an increase in unsafe abortions and associated complications. Another number that's quite daunting is that we foresee that a new 31 million additional cases of gender-based violence can be expected if the lockdown continues for at least 6 months. Also, due to the disruption of the programs to prevent female genital mutilation in response to COVID, 2 million female genital mutilation cases may occur over the next decade that could otherwise be averted. And also, because of the disruption of the efforts to end child marriage, we see also a potential growth of 13 million child marriages taking place between 2020 and 2030 that could otherwise be averted. And there's ample evidence how FGM has been increasing and child marriage has been increasing also during these 3 months of pandemic. And even the Secretary General highlighted in this response plan to COVID-19 on human rights and COVID-19. One of the recommendations is really to mitigate the impact of the crisis on women and girls, including their access to sexual and reproductive health and rights, protection from domestic and other forms of gender-based violence, and ensure their full and equal representation in decision-making on short-term mitigation and long-term recovery. So the whole family of the UN is in this together. I think Mohammed is gonna also add to different layers of this conversation, but gender is really on the spotlight now, and I'm using the word deliberately. And I think that we have really to take this crisis and the type of answers, the innovative answers that we are seeing, the breaking the traditional pattern. This is not business as usual, and it can never be business as usual, to make this really a turning point on the way we use gender as a lens, but also the way we respond to gender as a goal in itself, gender equality as a goal in itself. Thank you, Katerina.
Thank you so much. I mean, there's so much to unpack, and I hope we get to do that in the Q&A. One of the things you highlighted is also this question around coordination between different UN agencies, which is also one of the key concerns that came up in the poll with our audience. But without further ado, I would like to hear from Mohammed, who is, again, the Region Director of UN Women in Asia and the Pacific. And again, for you, Mohammed, the question, similar question, if you could give us some insight in the work of UN Women in this context.
Thank you, Katerina, and good to connect with you, Monica and Susan. Our region, and for those who do not know, different UN agencies have different definitions of what the region is. So for UN Women, the Asia-Pacific region spans from Iran all the way to Japan and then southwards to the Pacific Islands, which means that in fact, that it's few regions in one. There are stark differences in the socio-economic contexts, in the political situations, in how the cultures are manifested in everyday life. One thing in common there is that patriarchy is still very much alive in the lives and the minds and the hearts, not only of men and boys, but also of women and girls. It is still very much alive in the religious and political dogma and the systems that are governing these spaces upon the application of these dogmas. Which means, in very simple words, that men come first, and women and all the full spectrum of gender diversity comes next. Women and all genders have less access to opportunities. Women and all genders have less access to services. And for that, we have been working as the UN system at large, but also as UN Women, to attend to this at different levels. UN Women within the UN system is known to have what we call a triple mandate. So we work upstream, we work downstream in the programming, but we also work horizontally through the mandate that has been given to us by the Secretary General to coordinate the system-wide work on and for gender equality. In concrete terms, we've been working with the regional organizations here, like the ASEAN, like SAARC, regional IFIs like ADB, and with governments directly to support them in implementing and unpacking the international commitments that you have referred to in the opening, Katerina, whether it was the Beijing Platform for Action, whether it was the Convention on the Elimination of All Kinds of Discrimination Against Women, CEDAW, Security Council resolutions like the Women, Peace and Security Council resolution. We try to unpack that into concrete laws and policies and frameworks for these governments to ensure that they give access to women and girls and all genders in a way that men and boys have. At the same time, we try to substantiate the policy work that we do upstream by doing programming on the ground. The programming spans from working on the economic empowerment for women, working on ending violence against women and all genders, working on having women carve more space in the political sphere and wherever there is conflict to be at the negotiation table. But in addition to that, and it's in response to one of the questions in the poll about the coordination between the UN agencies or the lack thereof, there has been a very conscious political decision by the Secretary General to enhance the coordination. And for those who are not from the system, before 2015, we were working as UN agencies with what we call coordination mechanisms, trying to coordinate amongst ourselves, trying to best utilize the resources in order not to do redundant work amongst ourselves. From 2015 onwards, with the introduction of the SDGs, this has moved up from coordination mechanisms to collaboration platforms. And this brings me to the third level of our work, which is the horizontal coordination amongst UN agencies. And thanks to UNFPA, in fact, and UN Human Rights, OHCHR, and ourselves, we are co-leading at a regional level what we call an issue-based coalition on gender and human rights. This coalition is trying to work on the ground very swiftly to respond to the times and the needs of the here and now. And I will come back when I elaborate a bit more on what we do on COVID, but under this coalition, with the support of the other two agencies, we are embarking on a rapid assessment from a gender and human rights lens of the economic stimulus packages that have been rolled out by governments to respond to COVID. So this is basically, in a nutshell, what we do, Katerina, in the region: policy work, program work, and coordination on the ground. Back to you.
Thanks so much. And I think it's really important to highlight these efforts at coordination at different levels. You also feed nicely into my second question, because also I'm really interested in the work of UN Women, in particular in response to COVID-19. What are the key concerns? Maybe you can highlight some of the responses from your side.
COVID-19 came to amplify the challenges and discrimination against women and girls and all genders. It showed and exposed the economic fragility of women, given that the highest number of informal workers and informal sector workers are women. Those are the ones who are, they lack any kind of social protection or coverage by labor laws. These are the first to be let go, especially that it is largely in the service sector that has been hardly hit by COVID-19. It exposes very starkly the violence against women that has been extended to them in where they should feel safe, as Monica has just said, quoting the Secretary General. And even now, he has called the violence against women as the shadow pandemic. It has exposed how COVID becomes yet another instigator of conflict at the local level, where it is being used against certain ethnic minorities, religious minorities, to further curb the space and shut their voices. And in all that, we do continue to see, unfortunately, that the number of women leaders who are in every country having a say in formulating policies in response to COVID are not up to the level that we are expecting. So it is basically amplifying all the discriminatory practices that patriarchy is imposing on every single society. How are we responding to that? When it comes to economic empowerment, we're focusing more now on economic resilience instead of economic empowerment. How are we going to equip women and other genders with tools that would make them survive the pandemic? We're focusing more on, when it comes to ending violence against women, we're focusing on domestic violence. Given that now violence at home has spiked up and skyrocketed. And under that, we're working also on advocacy and preventive measures, given that the health systems are very thinly stretched to attend to the further treatment of survivors, and the system of the law enforcement is equally stretched to attend to the protection and to the prosecution. So we're working a lot on the prevention. In addition, we're working on advocacy in communities to fight stigma, to fight the social disruption that has happened in certain communities, especially in areas like Mindanao in the Philippines, or in countries like in Sri Lanka and China, where we had advocacy campaigns, not only as UN Women, but as the UN at large, to fight stigma. In addition, we are working with the system-wide, as I referred earlier, not only with UNFPA and UN Human Rights, but also as the custodian of ensuring that gender is being attended to under the UNDP-led work on the socio-economic response to COVID. As you know, the Secretary General has given the health response responsibility to be led by WHO, and the socio-economic response to be led by UNDP, having the UN system at large working towards that. So we are ensuring that gender is a part and parcel of this. The report that you referred to in your opening remarks, Katerina, the one that has been launched by the Secretary General in April, we were the pen holders for that. We are working to support and substantiate our work with data and analysis. So in addition to the excellent work that UNFPA has been doing, we have launched a survey, a telephone survey that has reached 27 million people in the region over the past few weeks. We're getting a sample between 3,000 and 10,000 per country in 13 countries to tell us what are the differentiated impact and equally what are the differentiated needs by women and girls and all genders during the times of COVID. I stop here and back to you, Katerina.
Thank you so much. And I think it will be really interesting to hear the outcomes of that survey. And I think it's really important to kind of look on the ground, what are the actual needs, what are the actual concerns. So I'm really looking forward to that report. Can you already say when the results will be published, if the results will be published?
Absolutely. It will be published and it will be made public to everyone. We've already had anecdotal findings from 5 countries. We're working on the other we should be having the regional report in a span of 3 weeks. And then that will be made available to everyone, but also this will inform and feed into a global report that UN Women is working at the time for the time being, that will include the other regions as well. The anecdotal findings are, while in the region the death toll has been higher amongst men, the emotional, the psychological, the mental impacts of the pandemic have been much higher on younger women. Between 60 and 70% of younger women have been affected severely mentally and psychologically by the pandemic, whether because of the economic insecurity or because of the violence that has been exerted on them, whether it was physical or mental. But also, in addition to that, the younger women in every society in Asia has been tasked, in addition to doing their daily work if they have a job outside the house, to continue caring for the elderly who are falling sick inside their households in extended families, their spouses and their children, the homeschooling, in addition to trying to be economically active and to continue to look for opportunities. Back to you.
Thank you so much. So this is really interesting. We got kind of a sense of how the UN system is responding, and also how the UN system is responding particularly on the ground. I would like to circle back to Susan, who gave us this introduction and overview, because Susan, you are also a researcher who looks into the fine details of this issue. You just completed a 5-year research project, which was called Trading Women's Rights in Transitions, Designing Diplomatic Interventions in Afghanistan and Myanmar, and the project was funded by the Australian Research Council. Very quickly, could you share some of your findings in relation to that project, and maybe also kind of use these findings to reflect back on how we respond to the COVID-19 pandemic?
Yes, I'll definitely focus on that. So there's an old diplomatic adage, that if you're not at the table, you might be on the menu. And that's basically what my research found, that because there were so few women in formal decision-making processes in the post-conflict environment, then really crisis was not a time for transformation or even it really challenged the concept of being post-conflict in both places. Crisis is a time when authoritarian tendencies can come out, as Mohammed has just explained. So I was expecting women's issues to be maybe ignored or struggling to be taken seriously by actors. I expected to see the UN as an ally in that struggle, which it was. The most important actors I found in both cases were women's civil society actors and alliances, who were crucial to this idea of transformative change, but were often ignored or not seen as particularly important by embassies in those countries, or not considered part of elite networks. So there's a lot that diplomacy can do to improve in that sector. But also, what I didn't expect to find was that women's status, as Mohammed has explained, can become a kind of a tradable commodity under certain patriarchal structures. So that means women's ability to work, to be educated, to occupy public office, public space, can become issues that become part of identity politics and nationalist politics for particular groups. So the UN likes to talk about post-conflict as a window of opportunity for women's rights, but I often saw it as a time of regression without really specific attention and help for civil society. So I feel this is going to be I'm seeing a lot of the similar kind of trends in this health crisis, and I feel like it's particularly important because we're about to have a climate situation that dwarfs even most of these conflict and health crises that we're dealing with at the moment. So if you think about this idea that these crises amplify existing inequalities and make it harder for marginalised groups to get their issues on the agenda. And so this idea that also we might be weathering the same storm, but people are in very different boats, and we have to understand the differential access they have to productive resources and their ability to have agency. So they're the kinds of things, and they're things we've talked about. Increased caregiving. So post-conflict society, under this pandemic, under climate change, we have to deal with the fact that women on this planet are undertaking 76% of unpaid care work. It's not a system that can survive. So this idea of invisible labour has to be front and centre on the diplomatic agenda. Also, loss of livelihoods. So 740 million women worldwide work in the formal economy, informal economy. In Asia Pacific, this is extremely high. So we have to really think about understanding how to support women with no government social support system who belong in the informal economy. We've talked about gender-based violence. I just want to point out that the way we respond to violence is a political choice. So if we've responded to domestic violence the way we respond to counterterrorism, terrorist activities, or violent extremism, we would have different outcomes. It's a question of women's lives mattering in the sense of the way political responses are framed. So that was another thing I found out. There is a correlation between intimate partner and family violence and state-sponsored violence and conflict. That is a correlation we have to understand much more clearly. And this point that both speakers have pointed out about the closure of civil space, it's been an incredibly difficult time. That COVID-19 has been used as a pretext to enact repressive laws and restrict fundamental rights, and I've seen that in post-conflict states as well. Very difficult personal status laws, or in Myanmar and Afghanistan, for example, and this very crucial issue of access to sexual and reproductive health and services, which is one of the key issues that the women I've interviewed in both countries has pointed out to me. One of the main issues they're interested in talking about is maternal mortality, child mortality, HIV, sexually transmitted diseases, adolescent pregnancy, etc. So I guess it's this question of, when there is a crisis, will we deal with that crisis by authoritarian means that block out the most marginalised, or do we do the extra work that means that we design, say, a Build Back Better idea that looks at social protections, that thinks about redesigning the formal economy and the way the workforce works, that counts people more clearly. I'm so nervous when I look at the numbers from Myanmar and Afghanistan, because I don't trust the numbers coming out around COVID deaths in either country, because I know what the health systems look like in those countries and their ability to count. So this data question is so important at the heart of all of this. So what does it mean for diplomacy? It means we have to be more radical and we have to be faster at doing this kind of analysis. So I think we tend to come up with the idea everyone has to stay at home, and then 2 months later, home is an unsafe place for most of the world's population. That was the most predictable consequence of that policy, and yet almost no country in the world got that right. So, that's, I think, a really clear example of not having that lens leading to pretty disastrous results.
Let me stop you here, unfortunately. I'm really sorry, because there's a lot more, I think. But let us bring in some questions and comments from the audience. We had an interesting debate and some really useful questions in the chat, and I think it's really important to try to bring them in, although time is extremely short for us today. Katerina, are you ready to share some of the questions and comments from the chat with us?
Hi, Kat. Yes, I'll try to be as brief as possible. Our participants have contributed to the discussion with valuable inputs and questions. For instance, Gloria Esposito asked what lessons we can draw from COVID-19 that can apply to combating gender inequality in the recovery period. Furthermore, Georgia Jancic asked how challenging it is to access aggregated data sources regarding gender inequality from countries that have limited access to technologies. Sonia Wagner asked if the COVID-19 crisis made it more difficult to attain SDG 5 related to gender equality. Dishani Seratante, apologies if I did not pronounce your name correctly, he expressed his concerns that international agencies and organizations are compelled to bear the burden of promoting gender equality in the face of lack of political will of governments, and how do we go forward in such a scenario. Jean Bushman would like to know how a patriarchy affects women's involvement in the diplomacy. And lastly, Ana Cansado asked if we can help enforce the voice of women's organizations and grassroots organizations in the international debate on post-COVID solutions. So that will be all from my end. Thank you.
Thank you so much. So some of the topics I noted down, question about gender equality in the recovery phase of COVID-19, challenges of accessing data, new challenges for reaching SDG 5 due to COVID-19, how UN agencies deal with the fact that in some countries political will might be lacking, and enhancing civil society organizations who deal with questions about gender, feminism, gender equality, equity, etc. A lot of questions covering a very, very broad field. So I would like to ask our speakers to maybe pick and choose the question they find most important, or they feel like the question they can speak to most. Would it be okay if I start with you, Susan, and then Monica, and then Mohammed? But please feel free to pick just one or two in response.
Well, I'm going to leave the Boris Johnson question because I don't understand Boris Johnson at all. But so I will talk about the women's civil society organisations. The UN has often provided the ability for women's civil society voices to reach power, to speak truth to power, and it was devastating when the Commission on the Status of Women was cancelled at such late notice this year. So the UN has a duty to do everything it can to amplify the voices of local women, but so do diplomats and so do missions in those countries. So I feel like that is something we can do better. We can amplify the voices of local civil society, all of us, academics, DiploFoundation, missions, individual ambassadors, all of us can do that. It's a question of listening and then making sure those people have access to the kind of forums of power that they need to have.
Thanks. Monica, what is your response to one or two of the questions we had?
Well, I would, thank you so much. I would stress for sure data. Not only because it's, as I said, it's our DNA, but also because you need data for advocacy, you need data so that you can inform program design. Because one of the things that frustrates us most, and I'm talking now as a citizen, is when we see a good idea being transformed into a program that clearly doesn't work in the field, especially because it was not tailor-made to that scenario, and that's also because there's a lot of data missing. But people need also to be mindful that data is very challenging in certain contexts. Someone mentioned technology. That's a huge obstacle in certain areas, but also because there is a political decision on which data do we gather and which data we made available. This is why the other issue I would comment is on political will, and I think that what this crisis can do for gender equality is really to make governments and communities understand to the maximum extent how tailoring the responses according also to their gender impact. It's not only one of the things they can do, but it's actually the smart thing they can do. And their civil society organization is really a good, well, it's not only a good, it's one of the key entry points. And I would add also faith-based organizations, given the experience we have with working with them, and also the very positive impact it's been having in our work. Thank you, Katerina.
Thank you so much. Mohammed, what is your response to some of the questions we had?
Thank you so much. I will combine the question on gender equality and in recovery, and also the one that is talking about the SDG 5 and the fear of losing the gains. And I would frame it under the opportunity for us to build back better. We should comprehensively look at the opportunity as providing us with a blank slate or an empty page, a blank page to come back with more equal ingredients to challenges and to problems. We need to ensure how are we going to quantify unpaid work. We need to look into how can we redistribute wealth by giving more access to the informal economy and the women who are working in the informal economy to have more voice and to have access to services. How are we going to have a more comprehensive system to the ending violence against women, where we're talking not only about the prevention, the protection, and the prosecution, but we look into the timeliness of it. How are we going to work on advocacy and the what I call the quartet of education, media, cultural narrative, and the work that we do with communities to change the mindset that it's not about men first and about patriarchy, but a more equal space for everyone. Back to you.
Thank you, Mohammed. And you mentioned something really important that I brought into the debate at the beginning as well, which is this question of building back better after COVID. So taking this as a way to close the debate, I would also like to hear from Monica and Sue, their kind of very brief comment on how do we build back better now? What are your reflections on this? Perhaps starting with Sue and then Monica for a very final word before we close.
I am interested in building back fairer. I don't want us to be in the position exactly we were before COVID, because that had so much structural inequality built into particularly macroeconomic policy. So I want us to think about building back fairer, and I want us to think about building back fairer in time for climate adaptation. I feel like the issues we're going to face from climate change are going to dwarf even what we're facing now. So we have to start preparing for a transformative society that can withstand climate change and climate impact.
Thank you. Monica, very final word for you.
Well, first, a very quick reaction to what Susan has just mentioned, because I think that this the climate change and the resilience, it's going to be critical even for sexual reproductive health and rights, which is not a very common question, but we are very keen on raising it and addressing it. But to build back better, I would focus on community-based health systems with resilient societies and with a human rights-based approach, but one that focuses on gender, but focus also in intersectionality, so that we can address all the stereotypes that we've been discussing. And then when we go back to business, it won't be business as usual, but it will be a different conversation with people at the center and human rights at the center.
Thank you so much. All that's left for me to do is thank our speakers for today. It has been an absolute pleasure, and I learned a lot, and we had a lot of room to engage in some very important questions. Let me also thank our audience for your comments and your questions and for joining us. We will be back next month with a different topic, but in the same framework. So I'm looking forward to seeing you then. And again, thank you to our excellent and very inspiring speakers.
Thank you.